Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on vhha.com and on popular podcast hosting apps, including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the Family Podcast Network. Podcast episodes also air each Saturday at noon and Sunday at 10 a.m. on 100.5 FM, 92.7 FM, and 820 a.m. across Central Virginia, 1650 a.m. in Hampton Roads, 105.1 FM, and 1050 a.m. in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. And today we're pleased to be joined by Dr. Jasmohan Bajaj, a physician and professor at the VCU School of Medicine. Dr. Bajaj is with us for a conversation about his work, research findings indicating a connection between cognitive decline and liver health, and more. So welcome to the show, Dr. Bajaj. Thanks for being with us.
Thank you so much for this invitation and looking forward to your questions.
Well, we're looking forward to this conversation. And on the subject of that, let's jump right in. It is our custom to start each episode by getting to know our guests a little bit better. As we noted, you're a physician and professor at the VCU School of Medicine. Your specialty is gastroenterology, which is medicine focused on treating digestive system disorders. And you have expertise in hepatic encephalopathy, which is a loss of brain function associated with the failure of the liver to remove toxins from the blood. We also know that you attended medical school in India and completed fellowship and residency at academic medical centers in Wisconsin and New York. Today, you're based at the VCU Stravitz Sanyal Institute for Liver Disease and Metabolic Health. Beyond those few professional details, Dr. Bajaj, what are some essential things about your unique personal story that you can share with us?
Thank you. You actually encapsulated a lot of this. I also actually primarily work at the VA, the Richmond Veterans Hospital, where I do see a lot of patients who traverse the entire spectrum of liver disease. As you said, my focus is on hepatic encephalopathy, and the point that is very important with hepatic encephalopathy that it is a very, very important connection between the gut, the liver, and the brain. And it is one of the most striking diseases that unfortunately affects not only the patients, but also their family members and everyone around them. That is a disease that has been fascinating me, so I'm trying to help ever since I was a medical student. And this is something that has been the focus of my research as well as clinical practice. And whatever I do is actually to try and not only understand the cause, but also to ensure that the proper patient gets the proper treatment and that newer and newer treatments are being tested for this condition.
Well, I appreciate that background. Dr. Arun Sanyal, your colleague at VCU Health, is a past guest on this podcast, and he joined us for an episode where we discussed a major gift to support the VCU Stravitz Sanyal Institute for Liver Disease and Metabolic Health. One of the things that struck me from that conversation is the importance of the liver in the human body. The liver is an essential organ that has many critical functions. As a baseline for continuing this conversation, Dr. Bajaj, I wonder if you can share some observations about the role of the liver and what it does.
How much time do you have? The liver has so many functions, and it is actually called one of the most altruistic organs because it actually takes in everything that is bad, cleans it out, and actually makes things that are good. So not only is the liver important for taking bad stuff, like you said, moving the toxins, but it is also important for actually digesting the food, creating proteins, creating things such as wide-ranging as clotting factors all the way to the proteins that we find in our blood and throughout the body. It has so many functions that actually it is impossible to list all of them. Suffice it to say that unlike dialysis that is sufficient to take care of the kidney dysfunction, there is no realistic dialysis for the liver because it's not just a clearing organ, it's also a making good things organ as well. So when the liver is not doing well, almost every single part of the body is not doing well as well. The problem with liver disease is it doesn't cause any symptoms until it is too late. And that's where we want to make sure that we actually are aware of who and who may not have liver disease, because it unfortunately can be quite well advanced even without symptoms. And the altruism part of the organ is because it takes all the bad stuff and does not even, cause a whimper until it is very late. So we need to be vigilant, not only as doctors and as medical practitioners, but also as the informed public to what is actually liver disease and what are the consequences and how a lot of liver disease can be, well, as we say, without symptoms. And we shouldn't wait till the symptoms occur before we seek medical attention.
And that's a great segue to this next question. So, for the layperson listening to this, what are some everyday steps or what guidance might you offer about behaviors, activities to support or promote liver health?
There's a lot of things here. The first thing, I focus on cirrhosis, which is the end stage of liver disease. And further on, cirrhosis is a condition called decompensation, where the liver kind of ends up failing. But there is a big, huge maw of patients before that, which is the patients who have not reached cirrhosis yet. And those are the patients that we need to obviously prevent them from developing cirrhosis. And some specific things that people can do is, if you have diabetes, please make sure it is under control. If you are overweight, try and see if you can reduce weight. And there are many medications, etc., that can help us currently as well, including and as well as diet and other things. If you're drinking alcohol, stop. There is no healthy alcohol at all. There is no healthy wine. There's no healthy beer. Alcohol is not really useful, at least for liver disease, and any alcohol is not very good. If you have a family history of liver disease, you may have a rare condition, and in that rare situation, you may want to talk to your doctor if there is something else that they can figure out to see if they can prevent liver disease, or at least make you aware of what are the symptoms of the liver disease, or what are the issues with liver disease once it actually gets progressed. But by and large, most patients who have liver disease in the United States have either obesity, or if they are overweight, or have diabetes, or they have alcohol, or they've had viral hepatitis, which is a bit of both. And unfortunately, all of these conditions, as from the liver standpoint, don't have any specific symptoms. But therefore, people, including medical practitioners taking care of patients who have these conditions, need to be extra vigilant to make sure that they are not missing liver disease in these patients.
Well, I appreciate that explanation. That actually helps us transition to our next question. We're recording this episode in May, which is Military Appreciation Month. And Dr. Bajaj, you mentioned that you work at the Veterans Affairs Hospital in Richmond. We're having this conversation today in part to talk about some new research that you've been involved in, which found that 1 in 10 older military veterans diagnosed with dementia may actually have cognitive decline that is attributable to cirrhosis of the liver, which you just mentioned as late-stage liver disease. If you would, tell us about this research and please explain its findings in more detail.
Thank you for bringing this up. This research that was published from our team in the JAMA Network Open earlier this year showed that what is the overlap as people with cirrhosis are growing older and as we get a lot of burden of dementia, is any of that dementia contributed by the hepatic encephalopathy that I just told you about. Now, why is that important? Because hepatic encephalopathy is relatively easily treatable compared to dementia, which is very hard to medically treat, and current therapies for dementia do have a lot of adverse events. So if we actually find out that some proportion of these patients who currently do not carry a diagnosis of cirrhosis or liver disease, remember I told you they have no symptoms, so unless someone is actually looking for them, they won't find it, or they won't even consider that liver disease could potentially contribute to this cognitive impairment. So what we ended up finding in a national cohort of more than 177,000 veterans with diagnosis of dementia, a score from the blood, which is very important for ruling out liver disease, was actually positive in 5 to 10% of these patients. We didn't stop there. We actually did validation across charts within the VA center, and what we found is the same 5 to 10% actually ended up being quite valid when individual charts were evaluated. And this all stems from prior studies that we have done. In people with dementia, cirrhosis is quite overlapping in those with hepatic encephalopathy. And we actually had 2 patients in the Veterans Hospital who were referred from elsewhere, who no one had suspected that they had liver disease. They were actually labeled dementia. And somehow or the other, they went to an external hospital where they were actually evaluated and they were treated for hepatic encephalopathy. And both of them, it was a night and day change in their mental function. So this is a scary part, that if there are a few people, even 5 to 10%, who potentially could be treated easily compared to the label of dementia, then this is something we want to not only tell the patients, their family members, but also to the practitioners who are taking care of potential patients with dementia.
And your research findings have led you to conclude that physicians treating patients with dementia should consider looking for liver disease in these individuals. You've addressed this a little bit, but I wonder if you can just really underscore this point about the importance of understanding the root cause of cognitive decline and how that might enhance treatment options or patient outcomes.
Yeah, that is really important because liver disease, even in people who have dementia, has many consequences, one of which could be hepatic encephalopathy. So if someone has undiagnosed cirrhosis, that needs to be diagnosed because patients with cirrhosis, unfortunately, also not only have hepatic encephalopathy, can get hepatic encephalopathy, they're also much more predisposed to developing horrifying complications such as swelling of the belly called ascites, or bleeding from the mouth, which is through because of those big veins that open up in the GI tract, and last but not the least, cancer of the liver. So regardless of whether the patient with dementia or patient with mild cognitive impairment has hepatic encephalopathy as a cause, but or not for their dementia or for their cognitive impairment, it is important for practitioners to figure out whether their liver disease is present in those patients or not, because not only hepatic encephalopathy, but other complications could also be potentially prevented/monitored in those patients. As far as hepatic encephalopathy is concerned, there could be only hepatic encephalopathy. There could be an overlap of hepatic encephalopathy and mild cognitive impairment/dementia in the same patient. So it is important for us to remember that hepatic encephalopathy can coexist with dementia and can coexist with mild cognitive impairment, which is the prior form of dementia as well. So if you are a practitioner or if you're dealing with someone who actually treats patients with dementia, it just takes, it's an equation called FIB4, FIB-4, fibrosis 4 score, which is very easy to calculate. It's publicly available. You have to add those 4 things in that very easy formulation. And if the score is high, then it is likely that this patient could potentially have cirrhosis, and therefore the confirmatory test should be started in those patients. Now, hepatic encephalopathy is easy to treat, but we first need to have suspicion to diagnose it in the first place. So I'm not saying that a lot of people with dementia will have it, but even if a significant minority have it, and that can be easily treatable, this is something that we would need to have the practitioners taking care of these patients aware of.
And then in terms of next steps, you mentioned the scope of this initial research. I think you said 170 plus thousand patients whose data was examined as part of this research. What are next steps here? Where do you go from here in terms of this body of work?
So if you remember, the veterans are a very different group from the rest of the U.S. population. They're much more likely to be male. They're much more likely to be older. And they're much more likely to be less diverse than the usual general population. So the next thing we did, and it is right now in preprint and under review, we tried to do this. We replicated the same study in another database called TriNetX, which is a database of patients who are not in the VA system and are much more representative of the general non-veteran VA U.S. population. And we found similar things. 7 to 13% of people with dementia who did not have a diagnosis of liver disease or cirrhosis before actually had a diagnosis with the same criteria that we had used for the VA as well. So this is a little bit more, and as we go more and more, as more and more data comes into as this prevalence of this thing, we need to create much more awareness among people as well as family members of patients with dementia or people who are taking care of patients with dementia to ensure that cirrhosis is not missed in those patients.
Well, one of the reasons I really enjoy this podcast series is because we get to have conversations with smart people like you, and I get to learn some things. So I really appreciate you sharing your knowledge and wisdom with us today. Before we let you go, we do have a tradition here on the podcast to close things out by asking our guests a pair of sort of fun, quirky, personal questions to wrap up. So, Dr. Bajaj, to keep things interesting, we have a list of 10 mystery questions. So if you choose two numbers between 1 and 10, I will give you the corresponding questions.
Okay, 3.
All right, 3. What is the best piece of advice you've ever received, and why does it stick with you?
The best piece of advice I got, and it's right here next to my desk, is never, never, never give up. It's a quote by Winston Churchill, and it's right here. It's given by one of my mentors, Dr. David Binyon, and it sticks right here. And the reason why it stays right here is because sometimes when you feel down in the dumps, you have to realize there's always a next day. We want to make sure that we do what we do, what gives us satisfaction in life.
That's absolutely great advice. The sun will always come out tomorrow, and sometimes, as you said, when it's difficult, we've got to trudge on and put one foot in front of the other. And then one more number between 1 and 10, sir.
Make it number 8, please.
Okay. Tell me one.
Number 8.
Number 8 is tell me one memory from your life that whenever you think of it, it makes you smile.
It's always with my family growing up. I grew up in India, as you said. And right now, it's very hard for us to, put all together because everyone is split apart. Everyone is busy with their own work. My family memories growing up with my family and my cousins and, getting into lots of trouble together. I think those are things that sustain me.
I think we all have memories like that of getting into shenanigans with cousins. So appreciate that. I think that's very relatable. And with that, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so that you know when new episodes are available. And we want to once again thank our guest, Dr. Jasmohan Bajaj, for joining us today. So thank you, sir.
Thank you so much for your wonderful questions and the podcast.